Hello friends, today we will understand something what is called as stages of cancer. See, everybody in this today's world, everybody talks about cancer and talks about stage, but a basic understanding of staging in cancer is something which is not known to many. They just simply by heart things. See, by hearting a subject is something, it's like a crime. Everything has a concept behind it. So in today's class we'll learn what is the concept behind the stage. Okay, concept of stages of cancer. So for now, see, you everybody know there are 4 stages of cancers, right? That is 1, 2, 3 and 4. Before coming to this, you should understand something. The cancer is a cellular pathology. Correct, no? Since it's a cellular pathology, you will have visible disease and invisible disease. So what does it mean? See, you cannot see everything in microscopy. What do you think is the limit? There is something called as only to a particular size level. There's something which you can see, and that is the rationale behind leaving 2 centimeter margin or 5 centimeter margin even in a cancer tumor, so that you are giving it microscopic removal or microscopic freedom from the disease. Got it? So that even if it's not there in microscope, that is something which you can't see, that is something which microscope can't see, but you need to be safe. To prevent recurrence, you cut that 2 centimeter margin. Okay, that is something which is the concept of that. And now there is something called as visible disease and invisible disease, which cannot be seen in microscope, is something called as invisible disease. Okay, now based on this visible and invisible disease, we'll see how the stages are divided. See, in first stage 90% is visible, 10% is invisible. Okay, in second stage 70% is visible, 30% is invisible. In third stage it's almost 50% visible and 50% invisible. But in fourth stage it's just 10% visible and 90% invisible. Now what conclusion you can draw? This can be a localized disease, localized cancer. These two can be regional disease, okay, or cancer. But this is a systemic disease. Okay, now you got the point. Now based on this, you know what are the treatment modalities available. Basically I am saying, okay, what are the basic treatment modalities you know of? Surgery, chemotherapy, radiotherapy, then again you have immunotherapy, hormonal therapy, which we will deal later. These 3 are basics, right? Now use your common sense and say me, what do you think is best for stage 1? You can see it. So since you can see it, what you can do? You can do surgery. So the best thing you can do in stage 1 is surgery. Got it? What about stage 2 and stage 3? It is you can see the maximum part of it, but there is something which is invisible also. So for maximum part, let us do the surgery. But for minimum which you can't see, you can either do chemotherapy or radiotherapy depending on the cancer. Okay, and the protocols given. But what happens here? Here the patient is already in a morbid state and also will have other comorbidities. Am I right? So doing surgery is not a part of palliative management. Correct? So here you than surgery, a palliative approach is something which has to be followed, and surgery and even radiotherapy causes pain. So better thing to do is chemotherapy, since it can go and at least reduce the number of cells. So this was the basic. Okay, now what did we study for in today's class? We understood what is the concept of staging in any solid cancers. Basically there's something called as visible disease and invisible disease. Based on this concept, we extrapolated what is in what stages do we have visible and invisible. Then based on that we understood what is the basic treatment modalities which can be used. See, this is something which is very very generalized, and a particular cancer will have a particular approach. Okay, these are something which you should know as a basic. Okay, that's why this comes under basic part of cancer staging and treatment modalities. I hope it's fine for today. For more videos, stay tuned. Thank you.